Dr. Piskin.
Yes, hi.
Hi. You talked about holistic dentistry and, how the mouth really affects many, many other bodies, just as other body parts affect many other different body parts. In fact, one of the biggest problem, I think, which is why diagnosis is so important, is that when we have a headache, we don't necessarily have a problem in the head. And when we have a tummy ache, we don't necessarily have a problem in the tummy, even though that's where it shows up. Now, let's talk headache, shoulder pain, back pain caused by the mouth because the hinges are not aligned. The mouth is not aligned for whatever reason that comes. I think the word is TMJ. I don't know how to pronounce the full word, but talk a little bit about it. Talk how it can be fixed and what all gets affected by that problem in the mouth, which, how life gets affected by that, which people don't realize.
Well, the biggest thing is that your lower jaw is not connected to another bone by any means. Just like a joint, it has a little mechanism over here, just like your elbow, and there are a lot of muscles that hold it all together. So a lot of people can associate it with jaw pain and joint pain and jaw pain, all related to head. Everything's connected. The head's connected to the spine, to the neck, and you have a lot of people that come in with a lot of pain in the face, pain on the joints, and they work at a desk and their head is always leaning forward. And so it's always advantageous to work with other specialties that could help someone with all this. Sometimes I'll send someone out for a massage because their shoulders and their muscles are so tense from lifting their shoulders and working at a desk, or the desk is too high, and then their whole neck is hurting them, and then their joints are hurting them, and of course we want to see that their teeth are working correctly and that the teeth, the puzzle is together. But I like to work with a lot of other specialties like chiropractors and massage therapists that can help my patients make sure that they're aligned, that their joints are aligned, that their muscles are relaxed, they're not tense, and all that can be related to the jaw itself, and that the muscles that come up into the neck, into the joint here, are not all tensed from grinding their teeth or clenching, or maybe they had some sort of an accident and they're still in spasm. So everything's related. So I like to work with my specialties to help me find out if it's a pain in the joint or in the head, that it's not just tooth related. Maybe there's other things going on.
Well, what I guess could possibly also happen, which you and me had a small talk before here, that a person has an aligned jaw. His jaws are out of line for whatever reason, which you just mentioned that might have happened. Missing teeth, being a big one, which is one of the main reasons people should fix their missing teeth and replace them with something, because, well, it's like a fence ball. It just goes all out of alignment if there's too many fence things missing. Now, posts, thank you. So now there's apparently I've heard that the joint here is the most complicated joint in the body because it goes three-dimensional. It doesn't move just kind of one way like the joint in the hip or so. And B, it has a tremendous amount of muscles attached, more than any other body part. Is that true, number one?
Sure, there's muscles that go up to the temple that go to the joint, and people have headaches in the temporalis area here. There's patients that have pain underneath the chin over here, and there's muscles that actually close the jaw, the masseter muscle, so they might have discovered that maybe they're clenching and they're grinding, and you could see their muscles are really getting big on the side of their face. There's patients that have ground their teeth down, and they look very collapsed in the front, because they've worn all their teeth down, and the joint does not like that. When the distance between your chin and your nose gets closer together, the joints become compressed, and the cartilage in there gets squished, and they get pain from that. So it could be from all different reasons, like you said, missing teeth, grinding the teeth, but there's so many different muscles. The jaw can move out and back, sideways, up and down, as opposed to other things like the knee, where it's supposed to be just bending at one direction. Once you start having the knee go this way, you've torn ligaments already by that point.
Right.
The same thing in the elbow.
Right.
So you're right. It's very complicated.
Right, so you have this complicated part here which we don't realize. We're using it only all the time, even when we sleep and snore. So we have that, and it's, let's say, out of alignment. So what you said, the muscle go up, the temporary here hurts. Well, most of us will call it a headache, right? And
That's
yet it comes from here. We may have lower back pain, shoulder back pain. We would call it lower back pain, shoulder back pain. And if you stretch a certain muscle for very long, doesn't matter why. For instance, you stretch it because here the muscle is out of alignment, it starts hurting here. So even if you fix that joint, that muscle still might be hurting because it is damaged. And because of that, the chiropractor or the massage therapist, sometimes even a podiatrist, might have to come in and fix it because the long time out of alignment here created a major out of alignment here, which even now if you fix this, the back or the shoulder or the head would just throw this back out again, and it would be an ongoing cycle. So you need to fix all of them together. Is that a little bit what you kind of try to say?
Right. If you look at someone walking down the hallway and you're behind them, a lot of times you'll look and you'll see that one shoulder is higher than the other. They're tilted to one side. One hip is higher than the other. Or you can say open your mouth and your jaw, instead of just swinging straight up and down, swings to one side or the other. Why is that? Why doesn't it open straight? So there are things that are out of whack, just like in the body. And I'll see someone, they'll come in and they're lopsided. And that means something hurts them, or their posture is bad, or in dentistry, we're always tilting and moving. And I go to massage all the time to make sure that we get these muscles relaxed and they're not tensed and in spasm, just like you can have in your mouth too.
Right. So regardless of what creates a muscle tenseness or pain, whether it is that you use a computer a certain way all the time, or whether it is that your jaw was out of alignment for so long that the muscle was pushed, either way, you need to fix the cause, which in this case would be the jaw, and then go and as well make sure that the muscles and whatever bones because of it got out of alignment get fixed again, all the way down on the feet. Well, just one more example of, how much the head, influences and makes sense. Well, thanks for telling us about it. And that should help some people to maybe get rid of the headache, the shoulder pain. I mean, they may have tried 25 pillows, a few chiropractors, and all kind of helped for a while. But then, one thing they might sometimes not have looked at yet is maybe your teeth are just a tiny bit out of alignment. Because being a mechanical machinery engineer, I know when you get cogwheels out of alignment just a little bit, that machine is coming to a screeching halt eventually, and it doesn't take too long, frankly.
That's right. Well, I'm glad I can help you. There's some great professionals out there, like the dentist, and as well as the chiropractor, massage therapist, that can help people in need like you're describing.
Beautiful.
Glad I can help you.
Thank you very much.